Hello, welcome back to my channel. I don't know if you have a chance to watch my previous video. It was an introduction to this episode I'm going to do about health issues. Welcome back. Today I chose to talk about vitamin D. What's vitamin D? What is it important for? What is the sign and symptom of deficiencies, and how can we treat that deficiency so we won't end in a bigger medical problem? So stay tuned. So what is vitamin D? The nickname for vitamin D is the sunshine vitamin. And why we call it this? Because your skin makes it from after exposure to sunlight. Your kidney and liver help to make the active form of it, and this is how we get vitamin D. Also, you can get it from diet, like eggs and milk, and oily fish like salmon and cod. But with the time, with the people using more sunscreen, avoiding sunlight to prevent sun cancer, of course, and we want them to do that. And so we've seen more and more vitamin D deficiency. I'll talk about that in a little bit. But what does vitamin D do? So vitamin D is very important for bone growth and health. In babies, if deficient in vitamin D, they get bow-legged or knocked knee, which is the knee touching or the both leg. In adult, vitamin D can cause weakness in the bone because vitamin D is very important to absorb calcium, and the calcium very important to make our bones stronger. So osteoporosis is a result, and then fractures from small traumas, especially in elderly, that can cause them to be in the hospital and take them a while to heal. Also, vitamin D is very important for our mood, because they notice people who are deficient in vitamin D, symptoms get worse when it's weather changing from summer to fall, or when the weather is overcast. So we don't know if that because the sunlight help their mood and help the absorption of vitamin D, but they are connected. Vitamin D deficiency and depression, also anxiety. So having said that, what are the signs and symptoms of vitamin D deficiency, meaning low vitamin D? Back pain, muscle pain, fatigue, chronic fatigue, weakness, some forgetfulness. It's very common in elderly when they have low vitamin D with dementia. Also, vitamin D deficiency can cause hair loss, can cause depression, anxiety, and study has showed increased risk for certain cancers, including breast cancer, prostate cancer, and colon cancer. So after we discuss the signs and symptoms of the vitamin D deficiency, you can notice that they're very common with many other diseases. For example, depression can make you fatigue, you can have back pain for many other reasons, so on and so forth. How do you know if you are vitamin D deficient? And by the way, 6% of the adult population are vitamin D deficient. It's a simple blood test that your doctor can order, and basically we order the level of vitamin D3, the active form of vitamin D. So if your level come back low, it depends on how severe is the deficiency. If it's very severe, then your doctor will put you on once a week vitamin D3, 50,000 units weekly. If it's mild, you can take 1,000 to 4,000 units, international unit a day. And that is the recommended doses for vitamin D, 1,000 to 4,000. Otherwise, vitamin D toxicity has been noticed in many patients who trying to treat themselves, and they thought more is better, and they take higher than recommended dose. And you can actually feel good without no symptoms and can be having vitamin D toxicity. Because vitamin D is fat soluble, one of the few fat soluble vitamins. That means your body cannot get rid of it. So if you have extra, it just sit in your body and cause sign and symptom that you don't need because we're trying to treat it. We don't want the toxicity. So that's the recommended dose is 1,000 to 4,000 international unit a day for an adult with vitamin D deficiency. So now, after we talked about vitamin D, the sunshine vitamins, how can you make sure you're getting enough vitamin D daily? As I mentioned, from your diet, eggs and milks and oily fish, and sunshine exposure, sunlight exposure. And remember, if you're dark skin, you need more vitamin D because you don't absorb the sun. Sun rays doesn't work as good for vitamin D as in light skinned people. Make sure you put sunscreen, and if you are deficient, please have your doctor check your level every 3 months. Take supplements if it's weekly or daily, and keep your bone healthy. I hope you enjoyed this little topic about the sunshine vitamins. Please comment, and if you have any suggestions about topics you want me to talk about, subscribe and like, and I look forward to see you next time. Bye.